Hello, everyone. Dr. Hashem Hasabala here. I hope you are all staying safe and well. I wanted to comment on the great news that the emergency use authorization that was granted to the Pfizer coronavirus vaccine. It's pretty cool stuff. I've actually talked to specialists in immunology, and they're super excited about the technology and the great potential that messenger RNA vaccines have, not only for infectious diseases like COVID, but even cancer. So that's really exciting. I was early on in saying that I will not take a vaccine if the data is not good, if it was rushed or sent out for political or other reasons. And I have looked at this data, and the data seems pretty strong. It's early data. There definitely aren't long-term data to follow up on patients who've gotten the vaccine or people who've gotten the vaccine long-term. And so we'll definitely continue to keep an eye on that. At the same time, the data is pretty compelling. It seems to be very safe, with systemic side effects that are probably related to the body's immune response itself. And so that's a good thing. That's what the vaccine is supposed to do. It's supposed to elicit a vaccine response, an immune response, so that your body can fight off real infection. So there doesn't seem to be very many, if any, severe adverse effects. There were in the UK a few severe allergic reactions. 4 patients who got the vaccine in the study developed Bell's palsy, which is a paralysis on one side of the face. And none of the people on the placebo vaccine got that. So we'll have to see if that bears out with more people getting the vaccine. All in all, this seems to be a very safe and very effective vaccine. And I, for one, I'm going to take the vaccine when my opportunity is given to me. This is great news. This is a great time in the history of our country, in the history of this pandemic, in the history of science and medicine. So we all should be very excited. And God willing, this will be the beginning of the end of the horror of this pandemic.